What's up, y'all? It is the holidays. I'm LTJ Reeds. This is Throwing Light. And if you're not throwing light, you're not acting right. Remember, y'all, follow my YouTube page. All 2026, I'm going to be guiding y'all to my YouTube page. Throwing Lights, all Throwing Lights are on there. The Throwing Light Tour, which is going to be really huge. You'll be able to go see panelists discuss issues in our community we don't normally discuss. And you're going to see a lot of creative projects that I'm going to be doing myself and with my community. So please follow my YouTube channel. Just follow this video to that. Subscribe and see what you can find. So I have like it's now this is episode 133. So you were last here 33 episodes ago. I have Dr. Carlton Thomas
Yeah,
here, the most watched Throwing Light guest I had of the first 100 episodes,
that's
and
awesome.
we had discussed you coming back, and I'm glad we were able to get you back here to wrap up the year with your wisdom and
Oh,
your experience, because we got a lot of work we still need to do in our community, Carlton, especially when it comes to sexual health, and we got to keep having these conversations. So I'm grateful to have people like you that make sexual health cool and hip,
thank you. Yeah.
maybe come up with some sexual health dances. So I'm all up for the creativity. So this is
hmm
a specifically designed episode called Ask Dr. Carlton. On
Yes.
my Instagram, I posted last week questions that some of you submitted questions. So we put the questions together. And we're going to go through some of them, maybe all. It just depends on how the flow goes. So let's get ready to start. Welcome to Ask Dr. Carlton.
Yes.
Hello, Dr. Carlton. How are you today?
I'm doing great. Thank you for having me today.
I am glad. That makes you a three-timer. Woo.
Yeah. Do I get like a jacket when I hit five?
You're getting something, as I get the time and the resources. You will be well taken care of, sweetheart.
Oh, good.
Taken care of. You got a fun coming.
Yeah, I'll do a movie role. How about that?
Yeah, I'm working on it. Who knows? But that is actually that's actually an idea. You know,
Yeah,
because okay, we'll talk about that because I'm gonna work on it later.
sure.
Okay, so we're gonna go ahead and jump in. We're gonna go with our first question. I'm gonna go with this question first because I just feel like it's pretty general.
Yeah.
And it's actually the first one I got, which I it's a fair question.
Yeah.
How much sex is normal?
You know, normal is really, there's no normal. There's definitely some pathologic, but the normal amount of sex a person has really varies by a lot of factors, by their age, their relationship status, their health, their libido, cultural and personal preferences, hormone levels. Some people are really amped up and want to have sex every day or multiple times a day. Some people have it once a week or once a month or once a year. And whatever really normal is where you want to be, what makes you comfortable, what makes you happy. What's abnormal is when it gets in the way of your normal daily life, like your job, your friends, your socialization, your responsibilities. That's like when people ask me how much masturbation is too much masturbation. I tell them, well, if you're masturbating at home and miss work, that's too much masturbation. That's pathologic. But otherwise, enjoy
It's a
it.
sex addiction, right? That's basically what you're saying. You're not.
Yeah, yeah. When it becomes an addiction and it interferes with things, that's when it's a problem. But really, normal varies among age groups, among situations, among where you are. I mean, like hell, I'm in my mid 50s now. When I was in my 20s, I wanted it a lot more than I want it now. Um, and so I think that's a pretty generalized thing. Some people are in their 50s and 60s are hornier now than they've ever been, for whatever reason.
Yeah, yeah.
So it really different. It really is different for everyone, and there's no standard definition of normal.
I just want to say, I work in property management and I work for the elder community.
Uh-huh.
I had a resident come in one time, well in her 70s, talk about how someone gave her an STD that lived this other guy. And old people are still getting at it. Let me just tell
They
you.
are. They are absolutely. They have some of them have vibrant sex lives, and that's great.
Yeah,
It gives
yeah.
me hope. You know.
Yeah, and I'm glad they were able to feel so comfortable to share that with me. Let's go to our next question.
Sure.
What's a good one? Okay, this is cool. Let's get into some cool questions. What are the most common STDs for lesbians?
That's a really good question. Lesbians have sex generally differently than gay guys or straight folks. Um, and it really depends on what they do. If they're sharing fluids, if they're sharing sex toys, um, those sorts of things. In general, HPV, the virus that causes genital warts and cervical cancer, is one that's a little bit more common. Overall, everything's less common. Herpes simplex 1 and 2. 1 is for the mouth, and 2 is for the genitals. And then trichomoniasis, which is a vaginal infection that can happen, is a little bit more common, especially if they share toys. Less common things are chlamydia, syphilis, gonorrhea, but they can happen. They're just a lot less common. And then rare ones are HIV and hepatitis B, the bloodborne ones, because generally lesbians aren't getting into things that are going to allow blood to pass back and forth, like
So,
penetrative anal sex or you know,
and
stuff
I
like.
think there's a big ignorance. First, the biggest
Hmm.
ignorance is that people forget about oral sex.
Yeah,
And
yeah.
like, let's be honest, they don't acknowledge that, and they don't think
Hmm.
about. But I don't think that, especially a lot of gay men in ignorance, don't associate penetration with lesbians, so they don't even think
Right.
that.
They don't even realize that lesbians do penetrate each other,
Right.
potentially. I think it also depends on if they have strictly been with women the whole time, or if they've had previous male sexual partners with penetration and previous STIs. That's one issue. Overall, much less common in lesbians, but like you said, oral sex can, and that's one of the reasons I'm really big on making sure people get their throat swabbed when they go for their STI checks, because you gotta check where you play. So if you put it in your mouth, get your throat swabbed for gonorrhea and chlamydia. If you put it in your butt and you share sex toys and you're not using a condom on those things, then uh, you can get gonorrhea or chlamydia that way. Um, Putting a condom on a sex toy and taking it off and keeping it clean is definitely a good way to prevent STI transmission among lesbians for sure.
And I, to be quite honest with you, I'm glad that question came up because I
Yeah, that's something.
feel
I'm
like
glad it came up too. But I was like, whoa,
Um,
okay, that's a good
yeah, like
one.
that doesn't, I don't encounter that a lot.
Yeah,
Okay, so gosh, these next two questions, they kind of feel similar, but I'll go with this.
yeah.
What STIs are rising and why are they rising?
Well, STIs in general across the board uh, over time are rising. The big ones that we're worried about now really are the syphilis, which is including congenital syphilis, which is rising every year. Syphilis can be pretty dangerous, especially for newborns or for people who have it for a long time and don't get it treated. It can lead to a lot of secondary complications like heart and lung disease, brain disease, eye disease. It can be neurologic disease. It can be pretty devastating. So that one's one that's on the rise. Gonorrhea also, especially the antibiotic resistant version, is one that we're a little bit more worried about. Definitely on the rise overall across the world. Chlamydia is the most common STI that is bacterial that we see. Also on the rise across the world. But in the United States in 2024, for the first time last year, there was a drop in the overall number of cases of syphilis, gonorrhea, and chlamydia, the big three, by just like 9%. Um, and now that doxypep has become more of a thing, that might explain a little bit of that, but we need to see if that pans out for the rest of it. Doxypep is where you take 200 milligrams of doxycycline within 24 to 72 hours of high risk non-monogamous sexual contact. Um, HPV is definitely a very common one of the most common ones in the world. HPV, again, like we talked about earlier, is the virus that causes anal warts, but it also can cause throat cancer, cervical cancer, anal cancer. Um, for the gay community, and especially the HIV positive community, it's important to know that HPV can lead to a much higher risk of anal cancer. So, new guidelines put out last year suggest that we should be doing anal pap smears on all HIV positive men who have sex with men starting at age 35 and do it yearly. And for everyone else who's HIV positive, 45. Um, and if those swabs become positive for precancerous cells, then you should go on to what's called a high resolution anoscopy to look and see if there's any precancerous changes. If they're there, they can be zapped and you can reduce your risk for anal cancer. There aren't a lot of cases of anal cancer, about 9,000 a year in the US, but definitely the highest risk is someone who's HIV positive, who also has HPV. Um, Herpes simplex is another one, obviously, that's very common. And then you've got your HIV and hepatitis, which are across the world really, really big. In the United States, overall, infections have been fairly stable, but there's still this, there's just some new data out of New York City that show that in Black and Latino populations, for the first time in a few years, it's going up. And that's a little concerning because, that was throughout the year 2024. Um, there are a lot of factors as to why people of color have new cases of HIV more than, say, white folks. Access to care, cultural stigma, racism. A lot of factors come into play when it comes to the prevention of HIV in those communities. But it's something that's definitely important and something we have to do a lot of work on in brown and black people in this country for sure. Um, yeah, so those are the big ones. And I think one of the other things you had asked is why. And we're picking up a lot more of them because we're testing people more. And especially in the queer community, we're using more of those throat tests, those rectal tests, in addition to the urine tests. And so we're picking up more. People are using condoms less. There seems to be obviously a decreased fear of HIV compared to when I was growing up in the 80s and 90s, where HIV was a death sentence, where it's completely not now. When someone's undetectable for HIV, they can't transmit the virus through sex. So um, that perceived decreased risk leads to people not using condoms as much because they're like, well, I can't, I'm on prep for HIV, or I don't think I'll get HIV, so I'm not going to use condoms. So the lack of barrier protection leads to increased STI risks as well. COVID kind of disrupted things a little bit too. A lot of people didn't seek care for a couple of years because they were pretty much homebound. So a lot of STIs weren't detected during that time because they weren't able to go to the doctor to get them treated. Um, and then stigma and care barriers, like we talked about with minority populations, was another big one too. Um, and then antibiotic resistance as well, because it's growing, especially in gonorrhea. There's a little bit more of it because it's harder to get rid of compared to previously.
So I'm going to go ahead and just ask these two questions. You can
Mm,
sum these up quickly because you already kind of hit on this.
hmm
So I have two questions related to HIV. The
Okay,
first one, if you are HIV negative, can you be in a long-term relationship with someone that is HIV positive?
absolutely you can. And the great thing about people who know their status, who are HIV positive and are on medications, generally, I think are a lot safer to be in a long-term relationship than someone who doesn't know their HIV status, or even or in a short-term sexual relationship as well. People who are HIV positive go on medications. They get their levels checked. They get their STI checks. They're on top of their sexual health a lot more than people who are negative in general. So I think it's of course when someone is undetectable, meaning they've taken the medications and the virus is so low, the level is so low that you can't detect it with standard laboratory tests. Science has proven that you cannot pass that virus through sex. So there are a lot of people who are in what we call serodiscordant relationships, meaning one is positive, one is negative, and have been that way for 15 years. So it's very clear that it's absolutely doable. And HIV is something that should never get in the way of you having a relationship with the love of your life. I
Yes.
mean, why miss out on the love of your life just because of a virus when that's completely controllable with medications?
That's how I thought. I
Yeah.
said, I came to that pretty early. I think it was probably my early 20s. Probably when I
Hmm.
was 22. I was like, you know what? If I fell in love with someone's HIV positive, I said I would just deal with it. It would just be a part of it. So I had already had that conversation with
Yeah.
myself. I don't know why, because I don't think that's, I'm not gonna use the word normal. I don't think we're sit around and think about what our limitations of love are very often. But
But
I didn't put that on the table as something that would prevent me from falling in love with someone.
yeah, but one of the things that kind of a lot of HIV positive people to this day get stigmatized on like hookup apps like Grindr, Scruff, Sniffies. If you say you're positive, people get nasty and block you or say
Yeah,
terrible things.
yeah.
And it's ridiculous, it's uncalled for, and there's still a lot of stigma and discrimination that we need to eliminate.
So, what is the most common stigma? This is my second question
Hmm.
of HIV that you face as a doctor.
I think when it comes to stigma for HIV among my peers is that lack of education about U equals U. Like I can be doing a procedure on a colonoscopy on somebody, and I'll have the nurse say, after the patient's completely sedated, "Hey, be careful with this when they're HIV positive." And I just look at them and tell them, "That's ridiculous. They're undetectable. We're using standard precautions to protect ourselves. We cannot get HIV from there. There's no need to be on high alert because this person is HIV positive. This isn't 1992, you know." So there's still that backwards thought thinking scenario about HIV. Um, a lot of people are still scared of it or they're ignorant of it. Those are also big stigmas that are important. I know a lot of friends in New York are saying that the young New Yorkers, are not using PrEP as much anymore because they didn't live through that time where people were dying left and right. I have friends in New York who were going to funerals like 3 times a week back in the 80s and 90s. That doesn't happen anymore because people live a normal, healthy life. So that's kind of leading to a little bit of, I guess, lackadaisical attitude about protecting oneself against HIV.
Mm. So, this is kind of an interesting question to get. And this came from a person. What is the worst STD or STDs to get?
Well, I mean,
Interesting question.
none of them are great.
Yeah.
But chlamydia and gonorrhea generally are very treatable. Like within a week, you're done with it, and as long as you're not reinfected from somebody else, you're done with it, right? Herpes is really frustrating because once you get it, it's there. You're always gonna be positive for herpes because there's no cure for it. Um, but even herpes, a lot of people have been exposed to the virus and have antibodies. I think in the gay community, there was one study that showed well over 60 or 70% of gay men had antibodies to either herpes 1 or herpes 2. Um, and they just don't display any symptoms of it. Now, if you're having blisters and the symptoms of herpes, that's definitely a lot more um, of a thing that gets in the way of people's sex lives. Um, there's still a lot of stigma with herpes about whether or not someone can have sex with someone else just because they're positive for herpes and the other person's not. Um, so there's a lot of lack of education about herpes out there right now. Obviously, HIV, if untreated, now HIV, if treated, you can live a totally normal life, no big deal. But if someone's positive for HIV and they just let it go and never get checked, then your immune system can deteriorate, and that's like the 80s and 90s when people were dying. So that or even now, like in Africa and places where they don't have access to appropriate um, treatment, it's a scary one to get. Um, but HPV can cause cancers. It can kind of get in the way of your sex life a lot if you have them on your penis or on your vagina or anus. Um, the cancer risk is there, especially if you're HIV positive. And then there's newer ones out now, like the other viral ones that we are going to talk about that I think you had asked me about. We can talk about that too.
Yes.
Yeah.
I guess they're so we're about halfway through. This is one more specific kind of STD question
Hmm.
from a friend. All right.
Yeah.
Mpox.
Hmm.
The doctor, if you go in with Mpox, they're going to tell you that there's not a treatable cure and that you have to wait it out. Is that correct?
Well, it varies. It varies among the severity of it. So, mpox or monkeypox is something that circulated in Africa, in Central and West Africa. There's two what's called clades of it. The clades are the subtype. So, clade 2 is the one that hit the U.S. in 2022, and it's still kind of smoldering here. There's still a few cases here and there. And that's the one we've all got vaccinated for back in 2022, 2023. It's a two-shot vaccine series. The vaccine series is about 89% effective, so it's not a silver bullet. Even if you do get the vaccine, it doesn't necessarily mean you're not going to get infected. It's like the COVID vaccine. You still might get infected, but the symptoms will be a lot less if you're vaccinated. Usually people get blisters on spots most usually where the infection occurred, but they can occur all over the body as well. So if you're a top, you get them on the penis, if you, or the testicles. If you're a bottom around the anal canal or inside the rectum, if you were just a side, then it could be in your mouth, and then some on your skins, in between your fingers, that sort of thing, on your trunk. Um, HIV positive people who are untreated or not undetectable are at much higher risk of having adverse effects from mpox. So, in someone who's having severe symptoms, there is actually a treatment called TPOX. It's a medication that is because mpox is kind of like smallpox. It was in the national arsenal for emergencies that they had to kind of break into when mpox happened here to start treating people. It's a 2-week course of this antiviral that you have to take like 3 times a day with high fat meals, um, and for it to get absorbed properly. But that definitely reduces the risk of dying, because there were about 38 to 40 deaths from mpox in the U.S. here in 2022, 2023, mostly from HIV positive guys who weren't treated well. So TPOX is that, but because it's one of those things it's kind of hard to get a hold of, it's really reserved for those special cases where people are just in either severe pain or severely ill. Um, One of the biggest things about mpox is treating the symptoms. So generally over time, over the course of 3 or 4 weeks, everything goes away. But when it hits you, it's like the flu with body and joint aches and a rash. Um, the lesions crust over time and scab off and fall off, kind of like if you ever had chicken pox as a kid. Um, Once you're infected with it, though, the likelihood of reinfection is incredibly low. So it's like less than 0.15% of people have gotten it twice when it comes to infections. Um, the more dangerous one, the clade 1, which has a higher mortality rate in Africa. And again, the mortality rate of clade 2 in Africa was 3%, and clade 1 is 10%. So that's a really high rate of mortality. 1 in 10 people getting it would die. But in Africa, there's not the medical care that we get here. There's not the amount of antivirals that we could use to treat it. So I don't think that rate is going to really, uh, that 10% rate is not definitely not going to be that high here in the US. There were three cases of that new clade one in LA about 3 months ago from people who had not traveled to Africa. So we know it is here, but after those first three cases were announced, no other ones were announced. So my thought is that that small kind of cluster in the LA area kind of just died off
Mhm.
as far as the viruses just got all treated and did well. So I think the real concern is that more virulent version of mpox becomes more widespread again. And really the best thing you can do to protect yourself is to get that two-shot series. There's two shots 28 days apart. But if you only got one shot and you can get a second one at any point down the line, you can get it at any time. You don't need to repeat the whole series. If you've been infected before, the guidance from the CDC, back when we had the good CDC, and the World Health Organization is you don't have to get vaccinated. But some people did anyway after exposure, just to because I didn't want to live through that again. Because for some people it was really horrible. People who have rectal mpox were sending me messages on Instagram when it was going on, where they felt like a potato peeler was going up and down inside of them constantly for hours with no relief. So it was definitely a brutal infection back in
Woo.
2022, 23, especially for bottoms. And luckily, through my social media stuff, I helped find an anti neurologic pain medication that actually dropped people's pain levels from 10 to one or two. Well, a follower of mine on Instagram said, "Hey, Dr. Carlton, I'm a pharmacist, and my dad takes gabapentin or Neurontin for his diabetes neuropathy pain." And I just took one just for the hell of it because I was in 10 out of 10 pain and my pain went down to a 2 out of 10. So that immediately told me this is a nerve type pain that's happening. And so I started telling everyone else, ask for gabapentin or Neurontin. And they did, and they all reported back to me, oh my God, my pain got better immediately. So I actually formulated that in a letter to the CDC, and then they made it part of the treatment protocol
That's
for
amazing.
mpox pain. So that was kind of like it's one of those things where social media is often deemed as a bad thing, but in this case, it was a good thing.
That's amazing.
um, yeah, so it's pretty cool. Yeah, so mpox is still out there. Um, I know in New York, there's been about 15 cases per week the last few months, which in a city of 10 million people, in the grand scheme of things, ain't a lot, but it's gone up from 3 or 4 cases to 10 or 15 cases. And in some of the other bigger cities like Seattle or in San Diego, we had 6 cases in October, and in November we had 12. So it's kind of smoldering down, kind of low. And a lot of people that are getting infected are people who've been vaccinated twice. So just because you've been vaccinated doesn't mean you're not at risk for it. So it's just one of those things. Like when I was in New York recently, and I had an opportunity to go out and about and maybe go to a bathhouse or something. And then one of my followers on Instagram messaged me and said, "Hey, I'm from California. I was just in New York, and I went to a popular bar there that has a cruising area, and I also went to a bathhouse there. And when I got home, I had lesions, even though I've been vaccinated twice, and my husband did too. And so that kind of made me kind of pull back a little bit and say, I can wait till I get home."
No, I get you.
Yeah.
Okay, so we got a couple more here.
Hmm.
So we're going to move away. So could having an STD affect your mental health?
Absolutely. Yeah. There are a lot of people who struggle with their sexual health and mental health together. Uh, People who are worried about how people are going to perceive them, like if someone has herpes or if they have HIV or something else that is perceived to get in the way of their sex life or their love life, their ability to form a relationship. It can really dig at some people. Some people are suffering through things like anal warts or genital warts, and the psychology of having um, does a virus affecting them in those locations can definitely do damage because if you're if you're top or if you're if you've got lesions on your penis, you don't want to whip it out and show somebody because they're going to reject you because they don't want to get them as well. So there's definitely a lot of negative consequences for people's mental health. Just like for any disease, when people get anything, it can have an impact. And your sexual health is just as important as your overall health and other matters. So when you have a ding in your sexual or personal health, it can definitely hit you mentally as well.
We got two more.
Yeah.
Okay, so where are places sexual health information could be put besides gay bars and LGBTQ health centers?
Well, there's this little podcast I've heard of called But Honestly, and we talk about it all the time. So podcasts are a way. Um, Bathhouses often have sexual health information as well, not just gay bars. Um, Online is big. My Instagram, there's other people who have Instagrams like mine who talk about sexual health and sexual health information. There's a lot of sexual health information on certain websites. The CDC has been really awful and have taken down a lot of stuff, but San Francisco AIDS Foundation has a great webpage, sfaids.org, and or San Francisco AIDS Foundation.org, and they talk about everything from PrEP to PEP, which is post-exposure prophylaxis when you haven't been taking a PrEP, to STIs, to HIV treatment. So lots of good stuff out there online, and things like SFAIDS online, my Instagram, my podcast. There's a lot of sexual health information out there. Sadly, the CDC is kind of, I don't trust them for anything right now. I don't trust them for health data information. I don't trust them for vaccine recommendations anymore. It's been infiltrated by a bunch of people who are incompetent, and it definitely would not go to the CDC as a source for anything these days.
So we got another question and then a bonus question.
Okay.
So this is actually just a question for me. And
Mm-hmm.
this is we're in the holiday spirit, and maybe you can answer this. Why is it a gift to yourself to be educated in sexual health?
I think it's empowerment. It's empowers you to be able to take control over your own well-being, and helps you make decisions about sexual activity that and the way you protect yourself or not. That can help you with uh, the way you take care of yourself. So by empowering yourself to know that you need to get checked in all your holes or wherever you played, it empowers you to make sure that those areas are protected. Make sure it empowers you to help protect the community by doing your part to get checked and treated when you're positive for something. Um, and just also for your own well-being. Like if you get syphilis or something like that, it can have terrible, damaging long-term effects. So by avoiding that sort of situation by getting checked properly, you can stay healthier and happier, and I think it's important.
Right on.
Hmm.
Okay. So we're towards the end here.
Great.
Well, normally where I would have the question, can you shed light? This is a special episode. So
Yeah.
instead, I have a bonus question of something
Okay.
that is new that you can educate us on.
Yeah.
But I'm going to go ahead and ask you this question.
Yeah.
So tell us about this 6 month prep shot that you got last month.
Yeah, I'm glad you asked me that. It's something I really wanted to cover today, so I appreciate that. So, there's a new shot out. A drug is called lenacapavir. The company name from Gilead is Yeztugo, Yeztugo. It's a lot easier to say than lenacapavir. Um, and it's kind of funny. I told the company that they should contact Chapel Roland and use her HOTTOGO song for YEZTUGO. You should take your yes to go, you know. um, so basically, it's a shot. It's a shot that you get every 6 months, and there's 100% effectiveness, 99.9% plus effectiveness at preventing HIV. It's much higher than PrEP, oral PrEP, because the reason for PrEP failures is when people forget to take pills. This, you get a shot. It's there, baby. You ain't going nowhere. You know, you're not gonna forget it. So the only thing about it is these shots go underneath your skin subcutaneously. And so I have kind of some belly fat from being having a dad bod. So I got mine in the lower part of my abdomen. And I had to ice it up a little bit on both sides for 15 minutes prior to the injection. They injected 1.5 cc's of that solution on each side to get in in there. And what it does is it kind of encapsulates and forms like these little. It almost like women get Norplant to prevent pregnancy. Those little subcutaneous little lumpy things that you can feel. I can feel two little tiny pea-sized lumps, one on each side of my belly, from these injections. The tissue from that, because it encapsulates, dissolves over 6 to 12 months. So it shouldn't be a permanent thing. But uh, it hurt for about 8 days, just mildly, like 2 out of 10 pain. You take 2 pills the day you get your injections, and you take 2 more pills the next day, and then within a week, you're covered for your 6 months. And then you go back and get your shot 6 months later. Now, there is a every 2 month shot called Apretude, or cabotegravir. That shot, they usually give it in your butt, and it's pretty painful. And you have to go get the shot done at your doctor's office every 2 months. I'm too busy to go to the doctor every 2 months. Like I barely can go. I could barely go every 3 months to get my prep refills because I just have so little time. So for me, it was convenient. You only have to go twice a year to get your prep, your medications. It's incredibly effective. It also, Truvada, which is one of the long-term, the oldest drugs for PrEP, it can have bone density and kidney issues. So people can get lower bone density. They can get kidney dysfunction from it. And a lot of people who have kidney disease can't take oral PrEP because of this interaction on their kidneys. So this drug is another opportunity for people to be on PrEP that couldn't otherwise tolerate the GI side effects of oral PrEP. Descovy and Truvada both can cause some people getting pretty nauseous and they just can't handle it. I've had zero side effects from this shot, and I'm really excited about it. There's actually a study that's going on right now, and I know some friends of mine who I think it's UCSD they go to, University of California, San Diego. They're working on a once a year shot, and it's been incredibly effective too. So this every 6 month thing may end up being an every year shot.
That's amazing.
Um, when it comes to cost, a lot of people were like, "Oh, well, the cost is $28,000 for this shot, or this a year's worth of these shots." And I'm like, "Well, if you look at the price of oral Descovy, which I was on before, it was also $28,000 before insurance. But my insurance covered both the Descovy and the prep shot. Um, if you're really religious with pills and you don't have any issues with your kidneys and you've done really well with the pills, I don't really, yeah, I don't, it's maybe not as important, but hell, as I get older, I was forgetting my blood pressure pills in the morning. I was probably forgetting my prep until later in the day. So it just takes that human error out of prevention. So I'm really excited about it. More and more of my friends are getting it. Some people have said that they didn't like the way their abdomen felt afterwards for a few weeks, so they probably wouldn't do it again. But in the vast majority of people are like, oh hell yeah, that was great, no problem.
Right on. So,
Yeah.
and I just want to mention, we do have human errors. Sometimes we forget things, and if you are a
Hmm.
forgetful type, this might be something that you might want to consider.
Yeah, for
All right,
sure.
Dr. Carlton. Well, this has been our Ask Dr. Carlton episode. I'm glad to have you on here. I want to ask you to come back.
Oh,
I
of
want to
course.
just thank you for being a resource and being so readily available to have these conversations, and we appreciate it as a whole. And I definitely, like I said, you are a great resource.
Thank
Continue
you.
to just doing something unique and having this platform that gets people excited or at least interested in wanting to learn about their sexual health. So
Absolutely.
thank you. I appreciate it.
All right.
Well, there's one thing left to do.
Uh-huh.
Are you ready?
Yeah.
All right. Okay. One, two, three. Go ahead.
If you ain't throwing light, you ain't right.
Close.
You
You're
ain't
not.
acting right. You ain't acting right. Sorry.
You're
I got
fine.
distracted by a
I'm gonna let
text
you
from
do it
the.
over. I'm gonna let you do it over so I can click it right. So
Okay.
you're
All
gonna do
right.
it again. You ready? One, two, three.
If you ain't acting right, sorry. Let me do it again.
Okay. Okay. If you're not throwing light,
You ain't acting right. Right.
there you
Yeah.
go.
Okay. If you ain't throwing light, you ain't acting right.
There you go. Thank you so much for doing this episode.
Thank you so much. Appreciate it.
All right, y'all. That's been another episode of Throwing Light. I'm LTJ, and we are out.